Folks, for over 100 years, we were passive recipients of healthcare. We used to sit in front of the doctor and do whatever he said. Well, now times are changing. We only get 10 minutes with the doctor. It doesn't give him enough time to drill down on what's really wrong with us. So the rise of the smart patient is empowering you with the knowledge, empowering you to ask the tough questions so you could become the CEO of your own health.
A trend is rising among the current medical system. Patients are becoming smarter and taking a bigger interest in their own health. They know their own bodies better than any physician and are quickly realizing the current medical model of treating symptoms with medication is a failing practice. The only way to avoid it is to become a smart patient.
My kid at age 6 was diagnosed with ADHD, and they wanted to put him on meds at that point. He would come home from school saying, "I'm the bad kid." He would get in trouble for breaking pens and pencils and just in trouble all the time. And we did take him to the doctor, and they basically just wanted to put him on meds. And I was very unsatisfied. Our life was incredibly stressful.
They decided that maybe I had this or maybe I had that, so surgery after surgery. Well, the thing about surgery is the more you have, the more scar tissue you create. And as soon as you experience an infection, it wants to hide out in the scar tissue. Then, once you have it hiding out in your scar tissue, they just have to keep giving you stronger and stronger antibiotics over and over and over at incredible doses. And I just stayed most of my life in pain and weak with sickness.
The stress of running this company was a very significant and cumulative effect on me, and weight gain, anxiety, having difficulty sleeping. Well, having worked in business for my entire career, I thought stress was just part of the life that I was leading, and I had no idea what the impact of stress was on your body. And during the course of spending time with Russ, I began to realize that stress was part of my weight problem. Stress was having significant issues with the rest of my metabolic state. And what I did realize was that if I didn't get on top of it quickly, that I was going to have long-term physical problems.
And so I started a support group where I started inviting in a lot of experts that work on trying to heal these things instead of just medicate. So I learned from a very early age after my child was diagnosed that food has an enormous bearing on the behavior of your child.
So eventually I had had enough and I needed to get off the hamster wheel of all of this medication, all of these antibiotics that were not doing anything for me. They were Band-Aids, but I could feel that they were making the rest of my body sicker.
The Institute encourages their patients to play an active role in treatment, as well as preventative health measures, to ensure quality health and wellness for many years to come. The Institute provides extensive education and knowledge on a platform of sharing that allows us to connect with the best and brightest minds in the country. This open sharing of information benefits not only the patients, but is crucial in transforming medical treatment in America.
Aside from the impact of working with Russ's program that it's had on my physiology, I really understand how inadequate the general medical system is. It's basically designed to treat the masses as opposed to a more personalized or individualized approach.
I wanted a kid that was not drugged up and dull. I wanted a vivacious, exciting kid with a big personality, but healthy. And so I started watching the documentaries that are all available on Netflix. I started researching all of the alternative doctors and practitioners.
We all have a responsibility for our own health. We can't just rely on the doctors or the medical system. We have to know how our bodies work.
I've got to stay on top of all of these minor issues that really came about as a result of the review of my blood work. And a doctor, seeing him once or twice a year, isn't going to be able to help me with that.
Personalized medicine is really coming mainstream, and it's coming fast.
Medicine is really becoming much more personalized, and the testing that is done by Russ's program gets down to that individual, very personalized level.
I can tell you today, my child is unrecognizable from who he was 5-6 years ago. He's a brilliant kid, he's on honor roll, he's very attractive, very great body, very strong physique, and we've done it all naturally.
The most important thing that you can do for yourself and for your health is don't give up. The information is out there.
Things don't get better unless you take control of your health.
Get comfortable with the idea that you're biochemically unique. and get the answers from the research that you can talk to your doctors about.
Just want to encourage you guys to check it out and do your research, become educated, and do the best you can.
Why are we moving towards customized or personalized medicine? Because right now, traditional medicine is a guessing game. They're treating everybody the same way. The future of medicine is going to be customized to the individual, and that's exciting. You're going to have your own genome stored in your iPhone. You're going to be able to understand what nutritional deficiencies you're deficient in and understand how the environment is impacting your body. That's going to be the program that's going to keep your bodies resonating in your 80s, 90s, and 100. Folks, what you can do right now, if you're diagnosed with any disease at all, remember, it comes from multiple areas. The cure has to come from multiple areas. It's not just about taking a pill, okay? It's not just about taking a pill. Dementia, heart disease, cancer are all multifactorial. They come from multiple areas of your body, and if you could get your head around that, you could start the healing process for yourself.
Everybody and everybody has a story. Let us find out yours today.